Occupational Therapy Interventions for Handwriting by Karen Stornello. The purpose of this video is it was an assignment for my Occupational Therapy OTD 712 class. I am a doctoral student at Rocky Mountain University of Allied Health Professions, and my assignment was to present a research study to increase knowledge of interventions and to present evidence to support the intervention. The research study that I chose is called A Systematic Review of Interventions to Improve Handwriting. It was written by Mary Egan, Katja Feder, and Monica Hoy. For the abstract, the background is that handwriting difficulties are among the most common reasons for referral of children to occupational therapy. The purpose was to determine the effectiveness of handwriting interventions. The methods where a systematic review was carried out included studies where randomized or non-randomized controlled trials of interventions that could be used by an occupational therapist to improve written output, printing or writing among school-aged children identified as having difficulties with handwriting. Electronic searches of relevant databases were conducted up till January 2010. The findings were 11 studies that met the inclusion criteria. These studies tested relaxation and practice with or without EMG, sensory-based training without handwriting practice, and handwriting-based practice, which included sensory-focused or cognitive-focused handwriting practice. Regardless of the treatment type, interventions that did not include handwriting practice and those that included less than 20 practice sessions were deemed ineffective. The implications are that effective occupational therapy for improving handwriting must include adequate handwriting practice. The literature review included that 30 to 60% of a child's school day is comprised of fine motor activities, with handwriting tasks accounting for the majority of this time. That 10 to 30% of school-aged children experience handwriting difficulties, and that children with handwriting difficulties often require more time to complete assignments, which does impact their academic performance. The methods of the study included randomized and non-randomized controlled trials of interventions. Studies were excluded if they did not include a control group, if they addressed the effectiveness of interventions not used by an occupational therapist, like a medication, or if the interventions were designed to improve typed or computer-generated output, or included children who did not demonstrate problems with written output. Searches for relevant research articles were conducted electronically. The following information was extracted from the articles: the type of design, the number of participants in each group, age, and the gender of participants, details regarding the intervention, including the procedure, frequency, and duration, the outcome measures, and the post-test results. The standardized effect sizes of the mean difference between the post-test scores of the treatment and the control groups were used. A Cohen's d was used, and with a 95% confidence interval. The results. There were 11 trials that met the inclusion criteria, and 9 of them were randomized controlled trials. Interventions in the studies were categorized as relaxation and practice with or without EMG biofeedback. They were sensory-based training without handwriting practice, or handwriting-based practice. The effects of practice following relaxation exercises were examined in 2 of the studies. Carter and Russell in 1985 reported a statistically significant difference between the change scores of handwriting quality for children receiving biofeedback for muscle relaxation, visualization exercises for relaxation, and handwriting homework practice. However, an effect size could not be calculated due to the absence of post-test data. This study included a substantial handwriting practice component of 50 minutes 2 times a week over 5 weeks, plus nightly homework. Jackson and Hughes in 1978 also studied the effects of relaxation training on handwriting quality and speed. Their results were not significant for this intervention. Sensory-based training without handwriting practice interventions were examined in 3 studies. The effect sizes were small and not significant for improvement in handwriting legibility, speed, or proportion of errors. Some of the children who received the intervention did more poorly than those in the control group. 7 studies included handwriting interventions with a sensory-motor or cognitive focus. In one study, the focus was not identified, but likely included sensory-motor and cognitive interventions. In the studies that examined handwriting with a sensory-motor focus, students received enhanced kinesthetic, tactile, or auditory feedback while practicing letter formation. Following the intervention, children in the intervention group did not do better than those in the control group in terms of handwriting speed and legibility. In the studies using a cognitive focus, students received instruction to help them think their way through letter formation and self-correction. Motor imitation and practice writing letters from memory, with or without visual cues, produced significant improvement over the course of 24 sessions. In further studies, this author combined this handwriting practice with a handwriting club intervention. During those 60-minute sessions that were 2 times a week over 7 months, the handwriting club intervention, which included writing interventions such as composing stories, there was a small effect that was not significant. The effect size was 0.32. But the students in this intervention were almost 3 times more likely to pass a statewide writing examination. The odds ratio was actually 2.75. This was statistically significant. When differences in post-test data between interventions and control groups were reviewed according to the dose of the treatment received, a trend between the number of sessions and intervention effectiveness was determined. All studies with fewer than 2 practice sessions per week and fewer than 20 practice sessions total demonstrated ineffective results. Discussion. The results seem to clearly demonstrate that a practice component is necessary for handwriting improvement. A minimum amount of practice-based interventions and homework sessions are required for handwriting to improve. This is consistent with motor learning theory. It is unclear whether the handwriting practice requires a cognitive or sensory-motor component. It is suggested that there may be a developmental or maturational effect that may affect the selection of that focus. Only one study demonstrated an improvement in handwriting speed, and it had a relatively high number of practice sessions. The clinical implications of this systematic review is that effective intervention needs to incorporate adequate practice time. Building motivation for writing practice should be incorporated in the treatment plan and strategy. The OT should consult with teachers, parents, and students to determine if handwriting practice should be the focus of the intervention or if other output methods such as keyboarding, scribing, or voice-activated technology should be explored. Given the importance of handwriting practice found in this review, It is recommended that all students should receive more handwriting instruction and practice throughout their school day. Limitations of the study are that few studies considered the individualization of the intervention to respond to each child's specific problem areas. For instance, if the child has deficits with visual perception or motor planning. These studies tended to have small sample sizes, and post-test scores rather than change scores were used to determine effect sizes. However, a post hoc analysis using change scores and standard deviations revealed that there were no findings that contraindicated the overall conclusion of the review.